Hello everybody, my name is Stephanie Cutter. I'm an assistant to the President who's been working as part of a team to help implement the new healthcare law. The healthcare law was passed roughly 11 months ago and signed into law. The President made it clear then that he wanted us to move quickly but carefully to implement the law. There's been lots of talk recently about rolling back the Affordable Care Act, repealing it, and going back to the days of skyrocketing premiums and out-of-control costs for businesses. Today, I want to talk about the role of the Affordable Care Act in reducing premiums for families and strengthening our economy and creating jobs. Today we're going to focus on two charts. The first is a chart that shows the premium cost for a family of four with the law and without it. In 2014, when the law is fully implemented, a family of four making $33,000 a year will be paying roughly $1,500 per year in premium costs. A family of four making $55,000 a year will pay roughly $5,000 a year in premiums. A family of four making $77,000 per year will pay roughly $8,000 in premiums. And finally, a family making about $99,000 per year will pay roughly $9,000 in premiums. Now, if the law were repealed, these same families wouldn't have these savings because at any income level, a family of four in 2014 would be paying more than $11,000 per year in premium costs. As you can see, there is significant savings regardless of your income under the Affordable Care Act versus what costs would be without health reform, more than $11,000 per year for a family of four. There are several reasons why there is significant cost savings under the Affordable Care Act for a family of four and paying for their insurance premiums. First is the cost of uncompensated care. Because the Affordable Care Act brings more Americans into the healthcare system, we're going to be paying less to care for those without insurance. Today, for a family of four, over $1,000 per year is added to premiums to pay for the health care for people without insurance, people showing up in emergency rooms, getting the care that they need but not being able to pay for it. Those costs will be significantly reduced because we're bringing all of those people back into the health insurance system and getting them the care they need and not putting the burden on those with insurance. Another factor will be new exchanges established in 2014 that will allow millions of Americans to pool together, compare prices, and get the best bargain. The second reason we're reducing costs is because we are getting better value for your healthcare dollar. About a month ago, we put a rule in place under the law that is called the medical loss ratio rule, which means that your premium dollars, 80% of your premium dollars have to go to your healthcare instead of administrative costs or advertising or salaries at insurance companies. That gives you better value for your healthcare. The third reason we're seeing a reduction in premiums under the Affordable Care Act is because we are strengthening premium review laws, and we're already seeing the results of that all over the country. Not only do insurance companies have to justify their premium increases, but we are strengthening laws in states all over the country to review those premium increases to make sure that they're justified and that consumers are being protected. And finally, the last provision under the law that helps reduce costs for families are tax credits. It includes a number of tax credits to reduce the cost of health care for families and individuals to get them into the health insurance market in an affordable way. Now we're going to talk about not just the impact of healthcare reform on families, but the impact of healthcare reform on the economy and on job growth. I'm going to flip to another chart. Now I'd like to talk about the role of the Affordable Care Act in our continued economic growth and job creation. As a result of the Affordable Care Act, employer costs are going to drop significantly when the law is fully implemented. According to a study by the Business Roundtable, in 2019, when the law is fully implemented and all of its benefits are in place, employers will save roughly $3,000 per employee per year in healthcare costs. That helps them to grow, to be more competitive, to create jobs, and strengthen our economy. Now, I want to talk about a chart by a Harvard economist about the impact of repeal of the Affordable Care Act on job creation. As you can see, there is a conservative estimate and a less conservative estimate on how many jobs this country will lose. If the law is repealed, next year we could potentially lose between 50,000 jobs and 100,000 jobs in 2012 alone. Now fast forward this all the way to 2019 and when the law is fully implemented, and we could be losing roughly 500,000 jobs per year up to 800,000 jobs per year. On average, that's 250,000 to 400,000 jobs per year. In total, it's 2.5 million jobs to 4 million jobs this country would lose if we repealed the Affordable Care Act. Clearly, we cannot afford to go backwards. We have to continue to go forward, implement the law, strengthen our economy, and help grow our businesses.